Well, good afternoon. My friends, we're in the midst of a battle. We're fighting a war against a ruthless enemy, a deadly enemy. The virus is taking a terrible toll. People and families are struggling, and my heart breaks when I think about the pain that the families are enduring right now. And in this battle, during this critical moment in our history, how we handle this will define us. How we rise to the occasion will define us. And if we look back, if we look to the struggles of past generations, we see that circumstances do not define these moments. It's the people's response to those circumstances that define these moments. It's the people's response to adversity that defines the character of an entire generation. And years from now, when we look back on this critical period, the virus will not define this moment. We will define this moment. Our response to the virus will define this moment. Because this is our moment, and we will be proud when we look back. Not because of what the government is doing for the people. That's the smallest part of our story. It's what people are doing for each other. That's what makes me so proud to be your premier. It's what keeps me going. It's the people, the ordinary folks out there, stepping up, rising to the occasion, doing everything they can to support our heroes in the trenches, to support our frontline healthcare workers, the ones fighting day and night to beat this virus and keep us safe. They have our backs and we have theirs. On March the 20th, we issued a call to action. We asked Ontario companies to get in the fight, to retool, to help make critical supplies and equipment, to make the masks, gloves, and supplies our frontline healthcare workers need. And Ontario businesses have stepped up. We're mobilizing our manufacturing might. We're mobilizing our economy and our people. We're mobilizing to conquer COVID. We're retooling the economic engine of Confederation. We're turning our manufacturing firepower against this virus. We received over 14,000 submissions to Ontario Together portal. Thousands of businesses put up their hand to make critical medical supplies and equipment. To date, Ontario Together has provided 7,500 leads on emergency supplies, leading to $90 million in purchases of critical medical equipment and supplies. Supplies that will be sent straight to the front lines. That's 5.1 million surgical gloves, 20 million surgical masks, and 250,000 face shields. We purchased 50,000 units of hand sanitizer for our police officers at a time when this equipment is in short supply all around the world. We can't count on other countries, but we can count on each other. We can be proud of our homegrown solutions. Companies like Autoliv in Tilbury heard the call. They make airbags for cars. Now they have approval from Health Canada to make surgical gowns. The Canadian emergency medical manufacturers are delivering 340,000 pieces of PPE. And earlier today, I dropped by a grassroots PPE drive. These are private citizens stepping up to get desperately needed equipment to our brave men and women in the front lines. They're calling on anyone who has access to PPE. They're collecting thousands of pieces of PPE, and they are making a huge difference. So if you can help, please drop by today until 5 p.m. at XYZ Storage on Eastern Avenue. I went by personally to drop off a donation of 32,000 surgical masks from the Trillium Automobile Dealers Association. And I want to thank Haley Wickenheiser, Ryan Reynolds, and the entire team at Conquer COVID. It's incredible to see people stepping up. My friends, Ontario is rising to the occasion. The frontline healthcare heroes to the everyday heroes, doing everything they can to help. And as I said yesterday, it's through adversity that we unite. It's through adversity that we see what we are truly made of. And I'm so incredibly proud of all Ontario businesses, organizations, and people who have stepped up to make a real difference. And I know how hard it is on everyone. I know how hard it is to be separated from your families and loved ones during the holiday weekend. But this is a matter of life and death. Thousands of lives are on the line. And I'm so proud of everyone for doing the right thing. You are all champions. And I want to wish everyone a very happy Easter and happy Passover. Thank you, and God bless the people of Ontario. Thank you.
Go to the phone line for questions.
Before I go to the phone lines, I had a call the other day from a gentleman named Yoda, and he's put together just volunteers, just average people. And I was over there this morning, and that's how I received this Conquer COVID-19 T-shirt. And I just want to thank you, Yoda. That's part of Haley's team and Ryan's team. They're out there along with Jody and Dr. Ruby Alvey and Guri, all of you. And I'm leaving out probably 20, 30 names, all stepping up and working together. That's what I call the true Ontario spirit. So thank you, each and every one of you.
Okay, first question.
First question comes from Kari Virma from CBC News. Please go ahead.
And good afternoon, Premier and Minister Elliott and Minister Phillips. My question is for both the Premier and the Minister of Health. You know, we've heard about ongoing issues at Participation House in Markham, other long-term care facilities across the province struggling to maintain both personal support workers as well as nurses. What is the province doing to protect staff and residents that goes above and beyond the federal measures that were announced today? And what do you do to ensure there's enough staff? And Minister Elliott, you said last week you weren't planning to increase the rate of pay for PSWs like they're doing in British Columbia. But I mean, how can you try and get people to work in these facilities and put their lives at risk when they're paid so little?
Well, before I pass it over to Minister Elliott, I just want to thank all the people working in long-term care. You know, they're stepping up to the plate. I understand how hard it is for them to go in and how challenging it is. But we all have a duty to take care of the most vulnerable people out there. They're relying on us. We just can't leave people in beds. You know, these are people that cannot take care of themselves. You heard the terrible story in Quebec. And I know Premier Legault, he's just, you know, sick to his stomach over it. But as a society, as a province, as a people, we cannot just leave people there. And it's so sad. Just think of it. These are the most vulnerable. They could be your family member. They could be your grandparents. They could be your children. And we need to do everything we can to, first of all, make sure we support the frontline healthcare workers by providing them the PPE items that they need. But what happened in Markham is heartbreaking. We just can't abandon the most vulnerable. I'll pass it over to Minister Elliott.
Well, what happened in Quebec at the long-term care home and what happened at the Participation House in Markham is truly heartbreaking because they are people's family members, their loved ones, and they are truly, truly vulnerable people. They are not able to help themselves, and it is our duty to care for them. We want to make sure that they are safe and that they are comfortable. And I would say that the vast majority of our frontline providers are doing exactly that. They are putting themselves in danger, but they want to help, they want to make people well, and that they are staying there and they are doing their jobs. But what we've heard from them in turn is that they need personal protective equipment. They need that in order to be able to continue to do their jobs, to stay well, to keep their families well, and to keep their patients or residents well. So that is what we're doing. We are working 24/7. We have groups that are doing procurement across the province and doing international procurement. The Premier has indicated that we've had so many people that have stepped forward domestically to help produce sanitizer, gowns, surgical masks, ventilators, all of that equipment. That is what we really need to provide to our frontline providers. But if they should fall ill or if they should need respite, we also have the group of volunteers through the workforce group that we've put together through that portal. We've received applications from thousands of people that want to get involved, from retired nurses to medical students to internationally trained professionals. People are coming forward. We thank them for that because they want to do the work on the front lines, and we have their backs in terms of protective equipment. We're going to continue to supply that to make sure that they're safe and healthy.
And Minister, though, like I have a follow-up question on another topic, but just to that point, it's great that we're seeing retired workers and that coming back into the fold, but we're seeing a number of long-term care homes indicate that they are experiencing significant staffing woes. So what are you guys going to do to incentivize to keep people like PSWs coming into work and providing them things like PPE? And just on another note, it looks like that at least half of the COVID cases in various jurisdictions across Canada come from the under 49 crowd. So what is the government going to do to kind of alter its messaging to really focus in on young people to make sure that they are aware that it's them that are really spreading COVID-19?
Well, first on the issue of the workforce in some of the long-term care homes and so on, one of the key things that we are hearing is that they need personal protective equipment, that they, and we now have a directive from Dr. Williams that they are to wear face masks during their entire course of work and their entire shift. So I think that will be helpful. There's more, of course, that we need to do, and they need more resources as well in terms of people working there. We want to make sure through this additional workforce that has come forward, the volunteers that have come forward, that we can help them in both long-term care homes, retirement homes, and other congregate places of living, such as Participation House in Markham, which deals with intellectually challenged young people and older people as well. In terms of dealing with young people, we have expanded the criteria of some of the symptoms for COVID, that it reflects differently in younger people and more seniors. With younger people, that can be unexplained joint aches, it can be headaches, it can be other things that they might not typically think would be symptoms of COVID. We have expanded those categories. We are trying to let them know that these can be signs that they do have COVID. And of course, we're continuing with our message, asking people to please stay home. Please do not get into groups of more than 5 people. That is how COVID spreads. We need to stop that if we want to flatten that curve and make sure that Ontario flattens the curve and starts on the downturn. So all of these things are really important. We say them each and every day. They apply to seniors as much as they apply to young people. So we're going to continue with that message, and it's our expectation, our hope and expectation that young people will get that message and will stop getting into groups of more than 5 people.
Next question.
Next question comes from Haley Cooper from News Talk 1010. Please go ahead.
Hi, my question is for the Premier. Only 2,000 tests have been done compared to 5,500 tests yesterday, and we're just wondering why that is. People are seeing these numbers come out daily. They're starting to get frustrated, as I'm sure you're getting frustrated. So why are we not seeing that number go up? We're in fact seeing it go down.
Well, as I mentioned, yes, I get frustrated when I see the numbers. We are ramping up. We have ramped up, and our goal is going to be 8,000. I believe it's April 15th, and I believe 14,000 April 25th, give or take a couple days. But we've given the direction. Let's get out there and start testing. And I'll be sitting down with our health team and asking that exact same question. But maybe I'll pass this over to the Minister of Health, and she can give you an explanation on that.
Well, we have significantly increased the number of daily tests that we're doing. We're up to almost 6,000 per day now, as the Premier indicated. The expectation is by April 15th that we will have increased, doubling to 8,000 tests and then doubling again by the end of April. So we do have a group that has developed a strategy for this. We are reaching out, of course, first to frontline providers, to the people who are working on the front lines in our healthcare system, and also to our first responders, as well as to people in long-term care homes where there has been an outbreak. We're now at, unfortunately, 101 homes that have had an experience, someone who has been diagnosed with COVID-19. So we need to concentrate our resources in those places so that we can identify anyone else who may have COVID-19 or COVID-19 symptoms to make sure that they can be put into self-isolation or hospital if that's necessary. So we want to focus our resources on the areas that are most significant, both in terms of our first responders and healthcare providers, but also to our most vulnerable populations. That's how we're rapidly increasing, and we're going to continue. We'll get to the doubling point within a few days, and then we will continue to double again with the next several weeks.
Thank you. And my follow-up question is for the Premier as well. I asked Minister Lecce yesterday about grocery store workers being added to the list of workers eligible for emergency 24/7 daycare. And he said that talks are still in the works of expanding that list. And I just wondered when we might see grocery store workers added to that list. You know, are the daycares up to capacity, and what's the holdup?
Well, we've chatted with Minister Lecce yesterday about that. He was actually down at Queen's Park. He's adjusting that list, and I have all the confidence in the world he's going to make sure he makes the right decision for any essential person out there, and grocery clerks and transit drivers as well. That list is very long, but I know that Minister Lecce will be coming out over the next short while, over the next few days, and adjusting the list that he has.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi there. I was hoping to follow up with Minister Elliott regarding the staffing issues in long-term care and other facilities for the vulnerable. Minister, is there anything else that the province can do to shore up more support for these places who are experiencing significant shortages, or where people have walked off the job, other than just relying on volunteers to come forward? What proactively is the government doing, and is calling in military aid an option?
Well, at this point, everything's on the table. I don't think military aid is required at this point, because we have had thousands of medical professionals who have come forward that are willing to help out in these situations. Many retired nurses who are being requalified by the regulatory colleges, medical students who are helping us with contact tracing and so on. So we are working with our public health officials in each of the areas where there has been COVID-19 cases diagnosed in long-term care homes to make sure that they have both the personal protective equipment but also the people on the ground in order to do the work. That's for long-term care homes. We're working with Minister Fullerton on that. With respect to places like the home in Markham, Providence, we are working with Minister Smith, the Minister of Children, Community and Social Services, to make sure that they also have the personal protective equipment in order to do their work, because this scans a number of ministries and jurisdictions. So we need to make sure, first of all, that people have the equipment that they need. Also that we have the necessary people in place. We're so fortunate that so many people have come forward. They are working, they're being deployed regionally and helping the local public health units where they've indicated that they need extra help.
And just on the issue of staff still working in multiple homes, we know that this is an issue for potentially spreading COVID-19. I know that Ontario has recommended that people not do that, but if they're working 2-3 jobs in order to make ends meet, what is the government going to do in order to order people to work in one home and to make up for the fact that they may be losing income? Will Ontario do as BC has done and ensure that people are only working in one facility?
Well, we are certainly aware that there are a number of people that are in that situation where they don't have full-time employment, perhaps in one home, and they have to work at 2 or 3 homes, that is a liability that we want, and we've asked people to only work in one place, but economically we know for a lot of people that's just not possible. So we're examining that now to figure out how we can help and make sure that someone is able to get that employment that they need in one home so they don't have to move to 2 or 3. That's going to be another key method of keeping COVID-19 out of long-term care homes and other places of congregate living.
Next question.
Next question comes from Travis Denrush of Global News. Please go ahead.
Hey there, Premier. There are a lot of concerns about what's happening in First Nations communities in Ontario. I have a letter here from one councillor of First Nations saying it has become increasingly apparent that there was no plan in place to contain an outbreak in an isolated reserve. We have been told to rely on our local pandemic plan and resources. Help is not coming, not in the way that we need. What is the government prepared to do to help these First Nations communities that are dealing with the outbreak?
Well, I've had a personal conversation with Regional Chief Roseanne Archibald, asking her to get a list of anything that she needs. I know Minister Rickford is on the phone daily, not every other day, daily with multiple regional chiefs across the province. I just finished putting in a call into Chief Clifford Bull at Sioux Outlook. I understand there's a case up there, asking him what they need. We also need, it falls under a federal jurisdiction, we need support from the federal government on this as well. And I know they'll be there. I know they're very passionate about helping Indigenous communities across this country. It also came up in the Premier's meeting. We're there for them. And again, we'll be reaching out constantly, looking at the requirements that they have. And with collaboration and cooperation from the federal government, we will be flying in supplies to regions that are needed. So I know this came up again the other day with the Prime Minister and other premiers, and the Prime Minister is committed that he will do whatever it takes to make sure we take care of our Indigenous communities right across this country.
And Premier, as you're well aware that millions of families in this province are trying to plan their lives right now, you have extended the emergency order, and you said that you were waiting on more data to give parents a definitive answer on whether or not they should plan for school to be closed for the remainder of the school year. Can you give them that answer? And if not, why not, when other provinces have been able to do that?
Yeah, well, the reason why not, we don't know where we're going to be in 2 weeks. We're expecting a spike over the next few weeks. And the last thing we want to do, Travis, is put our kids in harm's way. So that will be a decision we'll be making after we speak to our Chief Medical Officer. At the end of the day, he's gonna have the call on this. And then with full communication with our Minister of Education, along with school board, school trustees, teachers as well. It's absolutely critical. We speak to our teachers, and by the way, another shout out to the teachers. You're doing an incredible job in the circumstances that we're facing right now. So we'll have all the stakeholders involved before we make that decision. But I think it'd be a little premature when we're still 3 weeks away from that to make that decision right now.
Next question.
Next question comes from Rachel Haynes from CTV. Please go ahead.
Hi, Premier. This is Rachel Haynes here from CTV National News. Just wanted to go back to what we're talking about the outbreaks in long-term care homes. Yeah. You're talking a lot about what needs to be done, but what about for the homes such as the one in Markham where the staff have already walked out? What more can you do for those long-term care homes where these people are already at risk in the homes that they're living in? Can you force their staff back to work? Do you need more help from the federal government?
Well, I've said right from day one with anyone, you can't physically force anyone. When you sign up to do a job, you have to think of the worst case scenarios, and that's why these people are heroes. Our frontline healthcare workers, they're heroes because when a crisis like this happen, who do we turn to? We turn to our frontline doctors, nurses, PSWs, healthcare workers, long-term care workers, seniors, to not leave their post. And vast majority, 99.9% of people are standing there working through it. That's what makes these people heroes. They're different than a lot of us out there. That they're incredible people. So we're doing everything we can to make sure we protect them. That will help them protect the most vulnerable. And again, I go back to the story in Quebec. When I heard that, it's heart-wrenching. How, I know it's very, very difficult. And until you walk a mile in their shoes, none of us can really appreciate the pressures they're facing on the front lines. How do you leave someone there for 2-3 days that happened in Quebec? And how do you humanly do that? I don't understand. It's heart-wrenching. So we're going to do everything we can, and I just want to thank again the people that are there in the long-term care at all our homes. They're absolute incredible people, and we thank them.
Follow-up?
Thank you. And I'd like to follow up on the contaminated swabs that the Toronto Star was reporting last night. What are we doing to ensure the quality of supplies that we're getting and also maintaining its proper distribution?
So a lot of these, I had this conversation with the Deputy Prime Minister. There was a couple shipments, and we do joint procurement with the federal government. The company over in Asia actually contacted the federal government and said they found swabs with mold on it. I think it was 100,000, and another company shipped in 200,000. We caught them. They're going to be corrected. That's a big difficulty. That's a massive problem. Relying, no matter if they're swabs or N95, masks, you have to make sure that we do the audit, which we did, and we did catch it. When you're relying on other countries around the world, that's why we can't rely on these other countries. We have to manufacture here moving forward. The business community have really ramped up. At least we have our own standards here in Canada and Health Canada and in each province that we can keep an eye on quality control and do audits throughout the whole system. But when you start relying on countries from around the world, you don't know what you're going to get until they land, and then you start opening up the boxes and doing the testing. The solution for this, manufacture here in Canada. And when we get through this, and I've said it over and over again to all the premiers, they're all in agreement, Prime Minister, we can never, ever let this happen to us again. We have the ingenuity, the skills, the manufacturing might and the engineering might that after this, we can go to Asia and save, what, 10 cents, 15 cents on a mask? It's not worth it. It's not worth it in putting ourselves in jeopardy. These are critical items that should be stored, and God forbid we ever face this again. And my biggest fear right now is the second wave, possibly coming in September. I pray every night that we don't see a second wave, because that would really be damaging.
Next question.
Next question comes from Brian Lilly from the Toronto Sun. Please go ahead.
Good afternoon, Premier. I have to say you look a bit more ready to go out on the road with AC/DC than a politician at the moment.
I know. I didn't, Brian, I just came back from a great group of people, and I promised them I'd put this shirt on And I'll tell you, it feels a lot more comfortable than those suits I wear.
I wanted to ask you about the statement you made off the top about Ontario being at war. How would you describe that? How would you say that we're at war compared to, and we're fighting an invisible enemy, I get that, but you know, we're not sending more people out into the factories, we're sending less. So how are we at war?
Well, we're at war with the most deadly virus we've ever seen in this world, in our generation at least. And like you said, Brian, it's we're at war at an enemy we can't see right now. And people are going to define this moment. You know, there's always so much that government can do, and we're doing everything we can. I know the federal government, municipal governments are all putting everything behind it. But it's the people that are going to win this war against this deadly virus by staying inside and making sure we practice social distancing. But it's the companies that it's like the cavalry coming over the top of the hill. These companies are just incredible, supplying a lot of the frontline healthcare workers with the PPE, the donations, like the folks that just average grassroots people started this Conquer COVID-19, the T-shirt that I'm wearing, reaching out to all these companies, and a big truck came in from Canadian Tire with skids of PPE items. Everyone is stepping up. That's how we're going to defeat this. It's not the traditional war by any means that we're out there, you know, with the guns and the cannons and everything else. It's a different type of war that our generation and has never seen before. But what's going to define us is how we tackle this. And the people of this province and this country are the most amazing, resilient people I've ever met. I'm so proud of every single person in this province. Incredible people. I'm very blessed to be the premier of the greatest province in the entire country.
You mentioned in your news release today about the 7,500 submissions that you've had through Together Ontario, $90 million of purchases. But just a moment ago, you were speaking about swabs that weren't up to standard. I'm wondering, have you received a lot of faulty or bogus submissions through Together Ontario? I know that in my email every day, I'm getting people trying to sell me supplies that you know as soon as you start reading the email that it's bogus. Have you had people trying to dupe the province, take advantage of the situation coming in through this?
Absolutely, and we've had this conversation with the feds as well, and you saw the little issue that the City of Toronto faced the other day with the masks as well. We're making sure we're doing audits on everything that's being shipped in. We're sending over items to UHN for Dr. Smith to make sure that they get tested, and over to Health Canada before we can use any of these items, because you know, it's as sick as it is, people actually try to scam the system in these times are disgusting. Those people should be thrown in jail, and the key should be thrown away, trying to make a buck off this virus. It's terrible. And a lot of this is happening overseas. You know, we talked to Deputy Premier, Prime Minister Freeland the other night, and I gave her a heads up on a large purchase. Someone gave us an address, and we did our due diligence, saying that there was tens of millions of masks in a warehouse in Minneapolis. First it was California, Texas, and New Jersey. Then it was Minneapolis. And I told our team, this stinks to high heaven. Let's start digging into this group. And they ended up giving us the 3M headquarters office. We called 3M, and they told us, hey, this is happening a lot. They just caught a big scam in Germany as well. So be aware. And we're going to do our due diligence before it gets out in the field. But, you know, Brian, there's always going to be very, very few bad apples, disgusting people that want to make a profit off the backs of people that are dying. They're disgusting, and if we ever catch them here in Ontario, I'll tell you, we'll come down on them like they've never seen before, and do the full extent of the law to make sure these people are put away.
Last question.
Last question is from Douglas Boyd from Rogers TV. Please go ahead.
Good afternoon, Premier.
Hi, Douglas.
Can you just tell us about, is there any talks of using the former General Motors plant to make these life-saving facilities?
Which plant was that? I'm sorry, Douglas, I didn't hear.
The General Motors plant in
Oshawa. Oh, General Motors, yeah. I haven't heard of it as of yet. I know General Motors out in Markham, they have a real high-tech center out there. I know they're pitching in, and Honda's pitching in, and Ford is doing the shields, and Toyota is out there. Toyota's offering their lean expertise team to make sure that the flow of the process is moving forward. And as you know, Toyota has the #1 plant in the world in efficiencies, and we want to thank them for coming forward and bringing the continuous improvement team to us and volunteering their skills and their trades. But I haven't heard of the GM plant out in Oshawa. I've heard about GM supporting us out in Markham, but I'll look into it. But all the auto part manufacturing companies and automobile manufacturers, they've all stepped up in a massive way. So I just want to thank them. And do you know what's amazing is how quickly they can transform from cars or auto parts into masks, into ventilators, into gowns. It just goes to show you what the talent I've been talking about for the last 19 months since I've become Premier is the talent, the smartest people in the world right here in Ontario, bar none. I'll put our team up against anyone in the world. They're absolutely incredible. But thank you. I'll follow up with the GM on that one. Thank you. Thank you so much, everyone. I want to wish everyone a very happy Easter and a happy Passover. Thank you, and God bless you. Thanks, everyone.